Hello friends, greetings for the day. Myself Dr. Dev Jha, pediatric pulmonologist and intensivist, Delhi and NCR. Today I will discuss in short about ILD in children. It is also called childhood interstitial lung disease. So it is different from interstitial lung disease which are seen in adults. So in children, ILD may start right from birth only, or it may appear later on. So there are different types of ILDs in children, and broadly it has been divided into two categories: appearing before 2 years of age and appearing after 2 years of age. And in adult, ILD simply means idiopathic pulmonary fibrosis. So diagnosing ILD is very important. In children, the most common symptom of ILD is dyspnea, maybe on exertion, and if severity increases, maybe at rest. So dyspnea is the most common symptom seen in ILD in children, followed by cough. So this dyspnea and cough is seen in so many respiratory diseases in children, but we have to pick up the diagnosis of ILD in children, and this is important because it has impact on lifestyle of children. Children have to grow. So there is a paradigm shift in the diagnosis of ILD in children. Previously, lung biopsy was mandatory for the diagnosis of ILD in children, but now most of the diagnoses are done by genetic study available in some advanced labs. So you can go for genetic study and diagnose ILD in children. In case of adults, in case of idiopathic pulmonary fibrosis, there is one published study in Canadian Respiratory Journal that says that most IPF patients are suffering from obstructive sleep apnea. GERD is very prominent and dangerous association of IPF, and restless legs movement are also there in IPF. So it is the duty of treating physician to do night polysomnography in cases of IPF, idiopathic pulmonary fibrosis, and pick up obstructive sleep apnea, and also diagnose GERD and treat it appropriately. If GERD and obstructive sleep apnea will be taken care of, there will be much improvement symptomatically in IPF patient in adults. With this, I finish this topic. For more learning, you can join fellowship program in pediatric pulmonology with bronchoscopy under aegis of Respiratory Foundation of India. Be aware, take care. Thank you very much.